mental health has become a global issue. But when it comes to health care, not all are treated equal. Black, Asian and minority ethnic patients face ongoing discrimination when accessing mental health services in the UK. So why are there disparities when accessing treatment? Reports over recent years have found that Black, Asian and minority ethnic patients face consistent mistreatment. When compared with the majority of the white population, they are more likely to be admitted to psychiatric hospitals, detained under the Mental Health Care Act and experience poor treatment outcomes. In the UK, 1 in 4 suffer mental health problems.
For too long, mental illness has been something of a hidden injustice in our country, shrouded in a completely unacceptable stigma and dangerously disregarded as a secondary issue to physical health.
In response, the UK government held the world's first global ministerial health summit in a shift to bring together influential and political leaders. But should the UK position itself as a global leader in mental health? Up to 200 signatories wrote a letter condemning the Mental Health Summit because of the discrimination that affects the UK's minority and ethnic communities. Rhianna Walcott, editor of The Colour of Madness, explores Black, Asian and minority ethnic mental health in the UK, including her own story.
I did have one particularly negative experience with a white counsellor where I felt deeply uncomfortable talking about my life because it was clear that she was consistently attributing these issues to my blackness and getting it wrong.
Critics say minority and ethnic mental health is underfunded, which is impacting training practitioners.
Yes, I think that there's definitely a need for further training in terms of cultural sensitivity and not just the kind that we have so far.
But minority groups are also ignoring the problem.
In our communities, we need to have more open discourse about mental health, and that doesn't just start in academic spaces. It absolutely has to be in community centres.
With culturally inappropriate treatment, misdiagnosis and over-medication for Black, Asian and minority ethnic people, do mental health services need to adopt better cultural practices?